You know, it's kind of a stark thought, but before we even get into these proposed changes, some projections showed the number of uninsured Americans could, well, basically double. We're talking upwards of 20 million people.
Wow.
Yeah.
Yeah.
Okay, let's unpack that because that massive number really highlights, what's potentially at stake here.
Absolutely. And what's fascinating, I think, is the potential domino effect, how changes in federal funding could ripple through insurance markets and then,
Yeah.
the wider economy.
Exactly. It's all connected. So for this deep dive, we've really zeroed in on a couple of key analyses. First up, there's the Congressional Budget Office, the CBO. They looked at the American Health Care Act.
Right, the AHCA.
Yeah. Think of their report as like a detailed projection how those specific proposed changes might hit the federal budget and maybe more importantly for you listening, health insurance coverage.
And then to sort of get that wider lens, we've also got an analysis from George Washington University, GWU. They were looking more at the bigger picture consequences.
The economy.
It's exactly the potential economic and employment fallout if key parts of the current health reform were repealed. Specifically, they focused on those premium tax credits, the ones that help people afford insurance, and the funding for Medicaid expansion.
Okay, so we've got two angles. The direct impact on coverage and budget from the CBO, and the broader economic ripples from GWU. Makes sense.
Mm-hmm. Different but related perspectives.
So for you, the listener, maybe you're trying to cut through all the noise and just grasp the core issues quickly but, thoroughly. Our goal today is to pull out those essential insights, maybe find those aha moments about how these analyses see things potentially shifting.
That's good.
All right, let's dive in. Maybe start with the CBO's view on the American Health Care Act.
Sure. So the CBO report really outlined how the AHCA aimed to, reshape the insurance market. A big piece of that was market stabilization.
Stabilization? How?
Well, they looked at things like the subsidies, financial help for people buying plans, and also federal grants to states through something called the Patient and State Stability Fund.
Oh.
The goal there was sort of twofold. Encourage a wide mix of people, including healthier folks, to get coverage and also help insurers handle the costs for people who need a lot of medical care.
Right, trying to balance the risk pool, basically. So what did the CBO project for premiums? Did they think costs would go up or down?
Well, it was kind of a mixed bag, actually, depending on the time frame. Initially, like before 2020, they projected average premiums in the non-group market, that's where people buy insurance on their own, could actually jump.
Jump up? How much?
Maybe 15% to 20% higher in 2018 and 2019 compared to what they would have been otherwise. And the main driver for that initial increase, getting rid of the penalty for not having insurance.
The individual mandate penalty.
Exactly. The thinking is without the penalty, fewer healthy people sign up, which makes the average cost for everyone else go up.
Okay, that makes sense, but you said it was mixed.
Right. Because starting in 2020, the CBO projected things would flip. They thought average premiums would then start to decrease.
Why the change?
They pointed to a few things. That Patient and State Stability Fund kicking in, getting rid of certain requirements about how much plans had to cover overall the actuarial value rules, and also an expectation that the mix of people enrolled would skew younger.
Younger people generally having lower healthcare costs.
Precisely. So by 2026, they projected average premiums could be roughly 10% lower than under the law at the time.
But wait, you mentioned age. That 10% lower figure was an average, right? Did it affect everyone the same way?
No, definitely not. And this is a really crucial point the CBO made. The premium changes would vary significantly by age.
How so?
Under the AHCA, the rules around age rating were set to change. Insurers would generally be allowed to charge older adults up to 5 times more than younger adults for the same plan.
5 times? What is it currently?
Currently, it's capped at 3 times more. So that's a big shift. It meant younger adults could see substantial reductions in their premiums.
Okay.
But older people, they can face much, much higher costs. It's sort of a fundamental shift in who bears the brunt of the premium costs.
Yeah, that's a major difference depending on how old you are. Okay, let's go back to those mandate penalties for a sec. You mentioned eliminating the individual one, but what about the employer one?
Right. The AHCA also looked at eliminating the penalties for larger employers who didn't offer qualifying coverage. The CBO analyzed that too.
And the impact.
Similar to the individual side, the immediate projection was fewer people having health insurance overall. If employers aren't penalized, fewer might offer coverage, or the coverage might change.
But there was a flip side for the government budget, right?
Yes. The CBO noted potential savings for the federal government. Fewer people insured means potentially lower enrollment in programs like Medicaid and fewer people getting subsidies in that non-group market. So a possible trade-off, lower coverage, but also lower federal spending in those areas.
Okay. And speaking of Medicaid, the AHCA proposed some really big changes there too, didn't it?
Oh, absolutely. The CBO analysis painted a picture of really significant shifts in federal funding for Medicaid.
What kind of
Well, starting in 2020, the proposal was to reduce the federal matching rate for the adults who became newly eligible under the ACA's Medicaid expansion.
reduce it how much?
Pretty substantially.
Yeah.
Under the ACA, the federal government picked up 90% of the cost for that expansion group. The AHCA proposed rolling that back down to the state's regular federal matching rate.
Which is much lower.
Much lower. On average, it's around 57%. So states would suddenly have to cover a much bigger chunk of the cost for those individuals or potentially scale back eligibility or benefits.
Wow. Okay. That's a big change for state budgets. Was that it for Medicaid?
No, there was more. The AHCA also proposed capping the growth in federal Medicaid payments per person, starting in 2020 as well.
Capping the growth. How would that work?
It would tie the annual increase in per enrollee payments to the medical care component of the Consumer Price Index, the CPIM, basically a measure of healthcare inflation.
Which might not keep pace with actual Medicaid cost growth sometimes.
That was a concern, yes. And the CBO put some numbers to these potential changes. They estimate about 14 million fewer people enrolled in Medicaid by 2026.
14 million fewer.
Yeah, that's about a 17% reduction compared to what they expected under the law then. And overall Medicaid spending, they projected it would be 25% lower by 2026. These are really substantial figures.
Huge numbers. Okay, so that's Medicaid. What about the rules for people buying insurance on their own in that non-group market, starting in 2020 under the AHCA?
Right, so the CBO detailed quite a few changes there too. First, the existing premium tax credits and the cost-sharing subsidies, those were slated for repeal.
So the help people get now to lower premiums and deductibles, gone.
Gone under that proposal, yes. And the basic health program option available in some states, that would be eliminated too.
Okay, so what replaced that assistance?
The HCA proposed creating a new refundable tax credit. It would still be aimed at helping people afford insurance in that non-group market, but it would work differently, structured differently.
And what about the plans themselves? Did the rules change for what insurers had to cover?
There were some key adjustments there. The requirement for insurers to cover those essential health benefits, like doctor visits, hospital stays, prescriptions, that was expected to remain. Same for the limit on out-of-pocket costs.
Right.
But the requirement for plans to cover a certain percentage of overall costs, that actuarial value, we talked about the 60% minimum bronze level under the ACA, that would be relaxed.
Meaning plans could potentially cover less, leaving people with higher deductibles or copays when they need care.
Potentially, yes. Though the CBO noted the other remaining requirements, like essential benefits and out-of-pocket limits, would likely constrain how low those actuarial values could actually go.
Okay. Anything else major for that market?
Yes, one more thing aimed at encouraging continuous coverage. A 30% premium surcharge.
A surcharge? For whom?
For people signing up for coverage, if they had had a gap in insurance, specifically being uninsured for more than 63 days in the previous year, it was meant as an incentive to stay covered.
Got it. But basic protections like not being denied for health status or charged more because you're sick or pre-existing condition coverage, those stayed.
The CBO indicated those key consumer protections were expected to remain under the AHCA framework. Guaranteed issue, no premium variation based on health status, pre-existing condition coverage, those were projected to continue.
Okay. So beyond the main insurance market stuff, did the CBO look at other budget impacts?
They did. They touched on several other areas. For instance, the repeal of the Prevention and Public Health Fund.
Okay.
There was an initial increase in funding for community health centers, but also a prohibition on federal funds going to certain entities providing family planning services.
That sounds like the Planned Parenthood funding debate.
Planned Parenthood was mentioned as the entity likely most affected, yes. The CBO estimated the budget impact, but also noted there could be offsetting costs elsewhere, potentially related to unintended pregnancy.
Right. Anything else?
They also noted their repeal of various other smaller Medicaid-related provisions. And, importantly, on the revenue side of the budget.
Ah, taxes.
Taxes, exactly. The CBO projected significant reductions in federal revenue. This was largely due to repealing various ACA-related taxes.
Like which ones?
Things like the extra hospital insurance payroll tax that higher income earners pay, and the surtax on net investment income for those same earners. Repealing those meant less money coming into the Treasury.
Okay, so big potential changes across the board, coverage, spending, taxes. But how sure was the CBO about all this? Predicting the future is hard.
Absolutely, and they were very clear about that. They emphasized significant uncertainty around all these estimates.
Why so uncertain?
Well, it's just incredibly complex to predict how everyone will react. How will individuals change their behavior? What choices will state governments make, especially regarding Medicaid? How will insurance companies adjust their plans and pricing? How will employers respond?
Lots of moving parts.
Exactly. So the CBO figures are their best estimates based on their models,
Well,
but they readily acknowledge the real-world outcomes could definitely differ. It gives us a framework, but not a crystal ball.
right, a valuable framework though. Okay, let's switch gears then. Let's move to that second analysis, the one from George Washington University. They looked at the economic and employment side, right?
That's right. The GWU report focused specifically on the potential broader economic ripples if two key pieces of the current law were repealed: the federal premium tax credits and the funding for the Medicaid expansion.
So taking away that federal money.
Exactly. They calculated a massive cut in federal spending flowing into states, projected at $140 billion just in 2019 alone if those two elements were eliminated.
$140 billion in 1 year. Wow.
Yeah, a huge withdrawal of funds from the healthcare system and the broader economy.
But I imagine that links back to the coverage numbers we talked about earlier.
It does. The GW analysis also pointed to that same projection.
Yeah.
At least 20 million more Americans becoming uninsured if these supports were removed.
Okay, so less funding, more uninsured. What about jobs? That was a big focus for them, right?
It really was. They went further to estimate the potential nationwide job losses directly resulting from repealing both the tax credits and the Medicaid expansion funding.
And the number.
Their estimate was around 2.6 million fewer jobs across the country in 2019.
2.6 million. That's huge. Where did they see those losses happening? Was it all in healthcare?
A big chunk was, yes. Around 912,000 fewer jobs projected in the healthcare sector itself. Makes sense, right? Less funding, fewer insured patients.
Right. But that's not the full 2.6 million. Where were the others?
That's the interesting part. They projected another 1.6 million jobs lost in other private sectors.
Like what?
Things like construction, real estate, retail trade, even finance and insurance, and almost 100,000 fewer jobs in the public sector, too.
So it ripples way beyond hospitals and doctors' offices. But
Yeah.
just to clarify, were these jobs disappearing from current levels or jobs that just wouldn't be created?
That's a key distinction. Their estimate was about how many fewer jobs the economy would likely have in 2019 compared to a scenario without the repeal. So it's about the negative impact on expected job growth, not necessarily layoffs from day one, though that could happen too.
Got it. Fewer jobs, less economic growth. Did they quantify the economic impact beyond jobs?
They did. These projected job losses translated into estimated losses in overall economic activity. They calculated about $188.4 billion lost in business output nationwide in 2019.
Then for states.
About $109.3 billion lost in gross state product, or GSP. That's the total value of goods and services produced across all states. Again, just for 2019 in their projection.
And presumably less economic activity means less tax revenue for governments.
Exactly. The GW analysis estimated that state and local governments could see their tax collections decrease by around $3.7 billion in 2019, which, could affect funding for schools, roads, other services.
Right. Now, you mentioned they looked at repealing tax credits and Medicaid expansion. Did those two things affect states differently?
Yes, that was an interesting part of their analysis. They pointed out that repealing the premium tax credits would likely hit all states directly,
Why all states?
because people use those tax credits to buy insurance on the health insurance marketplaces in every state. So taking that away impacts affordability everywhere.
Okay. And Medicaid expansion?
Repealing the federal funding for Medicaid expansion would have its most direct financial impact, primarily on the states that actually chose to expand their Medicaid programs under the ACA.
Which wasn't all states. How many was it again?
At the time of the report, it was 32 states, including D.C. So those states would feel the loss of that specific funding stream most acutely.
But does that mean states that didn't expand Medicaid would be totally fine if the expansion funding went away?
Not necessarily, according to GWU.
Yeah.
They argued that all states would likely experience some negative economic effects because state economies are interconnected. Think about it. Businesses and workers in states that did expand Medicaid buy goods and services from and sell to businesses and workers in states that didn't. So if one state's economy takes a hit, those effects can ripple across state lines.
Ah, the ripple effect again. Did they give any specific state examples?
They did. They highlighted potential impacts for several states in their tables. For instance, a state like Florida, which didn't expand Medicaid but has a large marketplace enrollment, was projected to see a very significant cut in federal funding, primarily due to the tax credit repeal.
Okay.
And states that did expand, like, say, Arizona, Ohio, Pennsylvania, West Virginia, they were projected to see substantial job losses linked specifically to the repeal of the Medicaid expansion funding, on top of losses from the tax credit repeal.
So it varies, but looks negative pretty much everywhere in their model.
That was their conclusion, yes.
Yeah.
Even a state like Utah, which hadn't expanded Medicaid at that time, was still projected to see job losses just from the repeal of the premium tax credit.
And this idea of ripples, is that related to the multiplier effect you hear about?
Exactly. That's the core concept. The initial cut in federal funding, say, to a hospital doesn't just stop there. The hospital might hire fewer people or buy fewer supplies.
Which affects the suppliers.
Right. And the hospital employees have less money to spend at local businesses and so on. That's the multiplier effect. The initial change triggers a larger chain reaction throughout the economy.
Makes sense. Did the GW researchers add any caveats, like things to keep in mind about their findings?
They did include some important ones. They noted their analysis assumed the economic effects would happen pretty quickly, maybe more immediately than they might in the real world. Things can take time to adjust.
Okay.
And they also stressed that their analysis focused only on the impact of repealing those specific ACA elements, the tax credits and Medicaid expansion funding. It didn't account for any potential offsetting effects, positive or negative, from other policy changes that might happen later.
So it's a snapshot of repealing just those two things.
Pretty much. A focused look in isolation. They also briefly touched on some alternative policy ideas.
Like what?
Things like allowing full tax deductibility for health insurance premiums or expanding health savings accounts, HSAs.
And what did they say about those?
Their analysis suggested those kinds of approaches could have very different impacts on who gets coverage and might tend to benefit higher-income individuals more than the existing structure, just highlighting that different tools lead to different outcomes.
You want winners and losers, potentially.
Yeah.
Okay, that gives us a good handle on the CBO and GWU perspectives on those earlier proposals. But things keep changing, right? Let's talk about more recent developments. There was the One Big Beautiful Bill that passed the House.
Yes, that's a much more current piece of legislation, although it's important to remember it hasn't passed the Senate or become law. But it contains a whole range of provisions.
Right, not just healthcare, but definitely some things that touch on it or related safety nets.
Yeah.
What were some of the key items in that bill based on reports?
Well, according to sources like BBC News and info from the White House, it included several things. A temporary increase in the standard tax deduction for people over 65.
Okay.
New work requirements for certain adults, childless, without disabilities to qualify for Medicaid. They'd need to work, like, 80 hours a month starting in late 2026.
Work requirements for Medicaid, that's been debated a lot. What else?
More frequent Medicaid re-enrollment, potentially every 6 months, and additional checks on income and residency. Also, changes to the deduction limit for state and local taxes, the SALT cap.
Ah, SALT. That affects people differently depending on the state?
It does. This proposed increasing the cap for married couples under a certain income level. Then there were changes proposed for SNAP, the food assistance program.
Changes like?
Increased state contributions required. And again, work requirements for certain enrollees, able-bodied adults without dependents.
Okay, so work requirements popping up in both Medicaid and SNAP proposals.
The bill also proposed ending federal income taxes on tips and overtime pay, and allowing deductions for interest on car loans, but only for cars made in the U.S.
Interesting. Lots of different pieces.
Definitely. Plus an increase in the child tax credit through 2028, a crucial increase in the overall federal debt ceiling, investment money for modernizing FAA air traffic facilities, and provisions aimed at supporting American energy dominance, including tax policies and rolling back a methane fee.
Wow. Okay. That really is a big bill, covering a lot of ground. So what were the reactions? I imagine pretty mixed.
Very mixed, yes. The White House highlighted support from various business and industry groups. Groups like the American Farm Bureau, Airlines for America, the National Association of Manufacturers.
What did they like?
They tended to praise the tax-related provisions, things like the SALT cap change, ending taxes on tips, and also the infrastructure investment in the FAA.
But I assume there was pushback, too.
Oh, absolutely. Reports noted strong criticism, particularly from Democrats. Their concerns focused heavily on the proposed changes to Medicaid and SNAP.
The work requirements and potentially making access harder.
Exactly. Worries about the impact on vulnerable people who rely on those programs for healthcare and food security. So you see very different perspectives depending on which parts of the bill you focus on and what your priorities are.
And as you said, this bill passed the House, but it still has to go through the Senate.
That's right. It now moves to the Senate, where debates will continue and changes are definitely possible. It's far from a done deal, and the final version, if one emerges, could look quite different.
Okay, so the legislative process is very much ongoing. Good reminder.
Crucial point.
All right, so as we kind of wrap up this deep dive, what are the big takeaways for you, the listener? It really seems like the potential changes we've discussed, whether from the earlier AHCA analysis or the broader economic look from GW, could have just incredibly complex, far-reaching consequences.
I think that's the main theme: complexity and interconnectedness. We're talking potential shifts in insurance markets, major impacts on federal and state budgets, and, as the GW report highlights, substantial effects on the economy and jobs.
And this more recent one big, beautiful bill just adds another layer, weaving together healthcare-related changes with broader tax and social program reforms.
Absolutely. It underscores how intertwined these policy areas are. We're potentially looking at significant realignments in how Americans access and pay for healthcare, shifts in government spending priorities, and those economic ripples extending well beyond just the healthcare sector itself.
So maybe a final thought for you to ponder. Considering these potential shifts, the market changes, the budget impacts, the economic forecasts, the diverse reactions to the latest bill, what do these analyses really suggest about the future landscape of healthcare access and, well, economic well-being in America?
And perhaps also, as these proposals evolve, how might the actual lived experiences of different groups, different age groups, people at different income levels, people in different states, how might their experiences be uniquely affected by whatever changes ultimately come to pass?
Those are really the critical questions, aren't they? The analyses give us frameworks and projections, but the human impact is what really matters.
Exactly. These reports offer valuable insights into potential futures, but the path ahead depends on so many factors, including the choices still to be made.
We definitely encourage you, if you're interested, to delve deeper. Look at the original CBO and GWU reports. Follow the news coverage on the current legislation. There's a lot more detail out there to help you form your own informed perspective on these really, really important issues.